एक में इसमें वो
यूट्यूब में से लो। इसमें ऐप ऑलरेडी इसमें इन्वॉल्व है।
भैया को नंबर एक्टिव हो गई, उसको भी दे दे। हाँ तो चलो, 5046 है लास्ट।
ओके, 777 00 5046
करते हैं उसकी बात। गुड मॉर्निंग, गुड मॉर्निंग, वी आर स्टार्टिंग। गुड मॉर्निंग। Good morning to everyone. Good morning. Good morning. Good morning. Please join in. After a long time, I am seeing you all. Yes, please join in. Good morning. Good morning. How are you all? Good morning to everyone. Sure. So we'll be starting the session now. Okay. So how are you all? Good morning. Good morning. Good morning to everyone. Just give me a minute. Okay. Setting up everything. And we will rock. So I'll tell you the plan. The plan is we will cover physiology. Okay. The whole physiology. And yeah, I am good, better than before. So the idea is we are going to finish all of the physiology, and once we finish all of the physiology, what we are going to do? We are going to, yes, do the questions. Okay, so I'll be discussing the questions also. Okay, so I want all of you to study with me so that we are able to get very, very, very good results. Okay, yeah, obviously I'll be speaking in English only, so all of you should study with me. All of you, yes, should learn properly. Hello, bhai, hello, good morning, good morning. How are you all going? How's your preparation going on? Okay, so let's start. Good morning once again. So, how are you all doing? Good morning, good morning. Yeah. So, the idea is basically exam would be on 30 July. And my request to you people is if you are preparing for 30 July exam, you should make sure that you are not making any mistake. The recipe of passing, I'll tell you, the recipe to passing is very simple. First and the foremost thing to pass the exam, what we need is first do all important topics. If you have not yet done them, that's a big blunder. So I've already given the thank you, love you all from every, okay. Don't worry, we'll do FMT sessions also. So all the sessions are planned. So till exam, we'll be having daily sessions, okay. So all the important topics we will also cover. And if you people also cover, it will be great. So my request would be, please cover all important topic, because they are going to be a key change, okay. Yeah, the 300 topics. I already given the list. I will repost the list again. So that is very, very, very important, okay. Love you all, okay. So that is the main thing. Do all important topic. Apart from all the important topic, what else we are also going to do? Yes, also you have to do PYQ. Why? Because I'm telling you, the important topic plus PYQ alone will give you 200 marks. Plus, anyone who master the important topic and PYQ, okay, and then finally do the chantings and mock test, which we are organizing for you, chanting and mock test. If you can do all these three things, chanting, mock, PYQ, important topic, and we are doing RRs, rapid revisions on the, yes, YouTube also for all of you. So I want all of you to benefit and pass. So target is ab ki baar 200 par pakka aayenge. Yes, so that's why we are telling you, you are going to see. Yeah, you can watch it again, okay. Don't worry, it will be extended, everything would be there, okay, clear? Yeah, so it is the start now. Take it as a fresh beginning. From today, take it as a new fresh beginning where you are doing everything and you will be having this, okay. Yeah, so we'll do mock, at least 3 mock you should do, okay. Okay, chalo. So please make a routine. Or schedule and follow it. The NLC one I've already shared to you, like physiology will be there today, tomorrow, then we'll be continuing with medicine. So I've already shared the routine as per that. So if you people follow that, it will be very, very, very important for you, okay. So that's why follow it, okay, and do the subject as per the plan. Don't do it randomly, okay. Like today I am feeling like watching Game of Thrones. So today I'll watch Game of Thrones. Today I'll watch Mirzapur. Then in the end you will remember nothing. So that's why please follow subject wise, finish a subject, do the PYQs, then next subject, then next subject. Yeah. So 40 days. Today I will teach you physio and you can surely get 5 marks from just today's class. Today class, okay. How is 40 into 5? It is 200. So that means if you daily cover 5 MCQ per day, 5 MCQ, just 5, that is 200 plus. Yeah, 5-year PYQ is important. That's why you can use the PYQ books of NLC and they are very effective methods of passing. So that's why, yeah, love you from India, Delhi. How's Bishkek doing? I hope Bishkek is doing good. Yeah, sure. So I think we'll start without any delay. So I've already shared the file with you, okay. So please don't write anything. My request is, okay, today is Rath Yatra. That's great, yeah. I hope all have the blessings of God with you, okay, and you all should succeed, yes, a lot. So I'm telling you once again a very important thing. First is, I have already shared the PDF. This is the PDF, okay, PDF of physiology, okay, but I will request you also make a PDF is there, also make one extra notebook. Make it NLC RR notebook now. NLC RR and chanting. So add extra points there, okay. Because what I'll do is add extra points. Like when I do a topic, I will give a summary. So that summary is like active, passive, primary active pump, secondary simple. So add this summary is there. It will very, very important. Okay, clear? Yeah, you can watch it later. Okay. So we'll keep it for you people to watch later. Don't worry. Okay. Fine. Yeah. So PYQ is not sufficient. Do my session. Okay. Do my session plus PYQ, because physiology is a very tricky subject. They don't repeat the question as such. They mainly repeat the topics and concepts. Okay. Chalo. So let's start now without any delay. So we are starting with physiology today. The PDF is in integrated learning channel and group. So you can go to Telegram and search integrated learning. So Telegram integrated learning. You can just search Telegram integrated learning and you will get the file there. Okay. Fine. Debima. Okay. Chal. So let's start without any delay, without any interruption. That is the case. So this is our channel. This is the file. Can you see? So this is the workbook file. You can use it, and that is for you people. Okay, fine. For the date today, yeah, mock will start within, I think, July will start, first week of July. Okay, chal. So first is in physiology, understand we have cell, and the cell is made up of what stuff? One is cell membrane, CM, and also we have the cytoplasm. So right now we are all made up of cells, and I'm discussing all the, yes, okay. Good morning Viraj bhai. Chalo, cytoplasm. Okay. Now the membrane is made up of lipids and proteins. Proteins are more. And the cytoplasm. Cytoplasm contain nucleus and cell organelle. ये सब लिखने की जरूरत नहीं, don't write it. So it contains the cytoplasm and various cell organelles. Okay, so cell organelle. Okay, good morning Jatin bhai. Good morning to everyone. Okay, so cell organelles. Let's discuss the cell membrane. So lipids. Okay, so the main lipids. This is this year NEET PG exam. Main lipids in CM are phospholipids. So don't forget this, phospholipids. Okay, and there are two types, major and minor. Extra point, major, minor. Who's major? It is DPPC. Minor is sphingomyelin. You can add this to the PDF also if you want, or you can write extra. So the major is DPPC and the minor is sphingomyelin. What is DPPC? Dipalmitoyl phosphatidyl. It has a very famous name. Anyone? Or what is the very famous name of DPPC? Anyone? Yeah, we'll do almost all subject RR. We are planning for all subjects. Anyone? What is the very famous name? Ask in exam everywhere. Okay, hint, surfactant. Phospholipids also make surfactant. Okay, no voice? नहीं यार, voice तो आ रही है, क्या बात कर रहे हो? Check. Yeah, voice is coming. Please check your device. Okay. Hello bhai, hello. Lecithin, yes, or lecithin. Or the lecithin. Are you clear? So, or it is the lecithin which is there. Okay. Very important topic because it is in surfactant also. Surfactant also contain these two. Fine. So this is also containing this. Okay. Yeah. I'll do all the parts. Don't worry. Chalo. Let's continue. Okay. So once again, so cell is the unit of life. Everything living is made up of our cell. Okay. and the best model for the membrane, cell membrane, is our Singer-Nicolson model, Singer-Nicolson. So cell has more protein and the main lipids are phospholipid, which I told you is DPPC and sphingomyelin. Okay. Now phospholipids are amphipathic molecules. They are which molecule? They are amphipathic. So they are what? Amphipathic. So they have two ends. Okay. One is a polar phosphate group, which is hydrophilic, and a non-polar tail, which is lipid chains, and they are hydrophobic. So this is again a very important topic, hydrophobic. So they look like this. This is a head, this is a tail. So this is what phospholipids look like, head and tail, and they're arranged as a bilayer, double layer, in which the heads are outside and the proteins, the lipids, in between. Okay? So they are arranged as bilayer, head, tail, and the proteins are inserted in between. So these are the proteins which are inserted between the lipids. Yes. Very good, Sonu. Yes. Now, are you clear? So this is your cell membrane where heads are on the outer margins, and what is there between them? Proteins are inserted between the, yes, phospholipids. Okay. Now, what function lipids perform? Three functions. First is integrity, that is keep everything together. So that's why, remember milk, when you boil the milk, there is a layer of fat on the top. So same way, it has a layer of fat on the top, so it's making the layer. Then flexibility. So membranes are very flexible, so they don't break easily, plus they are able to bend. And finally, solubility. What is solubility? Means that lipid soluble substances. So solubility means lipid soluble substances can easily cross the cell membrane, and they are non-polar substances. Which substances? Non-polar are water soluble. So remember, water soluble are polar. So what are water soluble? They are, yes, polar compounds. They can't cross the membrane. Okay. Now example are gases, thyroid and steroid hormone, vitamin A, D, E, K. They are what? They are all fat soluble, not water soluble. They are fat soluble substances. So summary क्या बनी? Fat soluble can easily cross lipid membrane. So fat soluble, okay, non-polar can cross lipid cell membrane. So they can cross the lipid cell membrane. Are you clear? So lipid cell membrane. But water soluble can't cross. But water soluble, polar, that is charged, like iron, salt, sugars, they can't cross. So they can't cross lipid cell membrane. Okay? So what they need? They need the help. So what the help them? So proteins of cell membrane. Help them cross. Khatam. So that's why, simple summary, yes, lipids are not allowing the water soluble to go. So that's why water soluble use what? They use the proteins of the membrane to cross. Okay. Example number one, ions. So we all know ions are what soluble? Tell me, what are ions soluble? Water soluble, lipid soluble, ions. Ions are what soluble? Yes, they are water soluble. That's why salt dissolve in water. Remember salt? So that's why they will use proteins called as channels or pumps. Easy हो गया? Yes, you are all right. Vijay, Viju, okay, Vivek, Abhishek, yes, very good. Priyanka, Abhishek, yes, once again. Yes, Khushbu, Joel, Shifali, Arkadeep, Yahya, Shabas, Sonu, Vaishnavi, Sajid, Sultana, Nisha, क्या बात है? Very good, you are all right. Okay, Arkadeep. So that's why they use this. Number two, water. So can water cross the lipid? Now, so water use aquaporin. So what do water use? Aquaporin. So water will be requiring aquaporin. Number three, what is? I will cover every topic of physiology. This RR is sufficient to solve even NEET PG questions. So if you are giving NEET PG, you can again watch it. If you are giving FMG exam, obviously you have to watch. There is no other option of physiology. Is there any other option of doing physiology in just 6-7 hours and get 10 plus marks in this subject? No, only this subject. Okay. Yeah, today whole physio would be covered in around 6 hours. Okay, around 5 o'clock we will finish. Okay, yeah, I'm telling you now, in 1 hour one system will be covered. Okay, chalo. Thank you very much. Your love and your appreciation is most important. Okay, so water use aquaporin, then solutes like sugars. Yeah, we will keep it on YouTube, don't worry. Okay, so solutes like sugars. Yeah, then also urea, amino acids, etc. They use carriers and transporters. And again, what are these carrier or transporters made up of? This carrier and transporters are basically made up of the proteins. Okay, thank you everyone. So they are again, example very famous, GLUT. What is GLUT is? Yes, it is glucose transporter. So GLUT is glucose transporter. Number 4. So what is the fourth? It is your, yes, water soluble. Yeah, I'll provide, don't worry. Okay, water soluble. Yes, water soluble. What thing? Water soluble hormones. Okay, and our neurotransmitters. What they use receptors to act inside cell. And again, receptors are nothing but what? Proteins. They are proteins of cell membrane. So they are the proteins. Very good. Yes, Sonu, you are right. And number 5 is antigens. So antigens are mostly proteins. Yes. Yes, Amir bhai, it will stay. You can watch it. So let's start now. So first question, what are they doing? So ions use proteins called as channels or pumps. Water use aquaporins. Solutes, sugar, urea, amino acids. Water soluble are using receptors. And finally antigens. So these are the functions. Okay. Antigens, you write example MSC or HLA or ABO, blood group antigens. So clear? So these are the case. Okay. See, haptans are not complete antigens. Okay, doctor, by chance. Okay. So they are not complete antigens, but yes, they can also be categorized as, yes, as proteins only. Okay. Chalo. So let's move next topic. Next topic is body fluids. Body. So remember, 60 to 70% of body weight is what? Is water. Called as what? Called as TBW. TBW is total body water. Okay, total body water. Okay, so it is total body water divided into two parts, ICF, ECF. 2/3, 1/3. So 2/3 and 1/3. Yeah, I'll be taking medicine also. Okay, 2/3 is ICF, 1/3 is ECF. What is ICF? Good thing they don't ask calculation. No need to do calculation. So again, I'm telling you one question. No calculations in exam. Okay. Why there are no calculations in exam? Because for past almost 3 years, there's not a single calculation asked in the exam. Last they asked was in 2020, 21, 22, 23. No. Why? Because they don't give paper pen, and doing mental calculation is not possible for everyone, especially if it's very confusing calculation. It's, if say 2 plus 2 4, like this kind of calculation can be asked, but complex, what is 1/3 equal to 60%, 80, that kind of questions are not asked, so you can ignore them. Okay, fine. PCM, what is PCM? Yeah, I don't understand. Okay, yeah, you don't have paper pen, na? Chalo. Now ECF is outside cell, is extracellular. PSM, I'll do, don't worry, we'll do all important. Even PSM they don't ask calculations. Next question. ECF is 2 parts. NB is just like your partner, girlfriend, boyfriend, wife, whatever. Okay, कभी नरम नरम, कभी गरम गरम. तो कभी बहुत ही हॉट होते हैं, कभी बहुत ही नरम होते हैं, कभी दया आ जाती है और कभी अपने असली स्वरूप में आ जाते हैं. दे शो देयर रियल ट्रू वर्जन. ओके, चलो. See Ronaldo, this is more than sufficient. Okay, clear? If I tell you there is nothing which is sufficient in life, like you will never be sufficient for your relatives, they'll always keep finding mistake. You will never be sufficient for your girlfriend or boyfriend, they'll keep finding mistake. थोड़ा ऐसा वैसा ये वो. So every person will find. Even people don't get happy with me, they keep finding mistake in me. कि सर अगर आप बाल थोड़ा छोटा करता अच्छा रहता, सर टी शर्ट ऐसा पहनता अच्छा होता, सर if you would have taught like this अच्छा होता, सर your handwriting, if you would have had a good handwriting, you would have been a very good teacher. So then I say, if better I would not have been a teacher, then you will not be able to point anything in me. So that's why, please, don't give advices which are not needed. Okay, chal. Let's next say is IF. Yes, that's more than sufficient. Okay, PYQ plus this. Okay, nothing, we just started. Okay, it is interstitial fluid. Okay, someone gave me a definition of the truth and I'll tell you. If you agree, tell me. Okay, someone said, what is an actual person like? Actual person. So he is not as good. He is not as good as his mother think. So not as good, उतना अच्छा नहीं जितना माँ सोचती है, and not as bad as his wife और गर्लफ्रेंड थिंक. सही है? तो ये किसी ने डेफिनेशन दी है, ठीक है? या सो ही इज नॉट एज गुड एज हिज मदर थिंक एंड नॉट एज बैड एज. And it's okay, I am okay now. Yes, I am hectic. Same way FMGs are not what? Okay, as you know, what do you say? Some people say they are very bichara kind of people. No, they are not bichara. They have good life. They have actually been independent people. They have 5-6 years good life. Okay, but also yes, there is a actual lack of sincerity that I feel. Okay, FMGs are ones who have, and the apps, they become like Son Papdi. That's what my opinion is. The apps have become like Son Papdi. No one uses the app. They just keep on selling, reselling. Prep available, 100 rupee only, 500 rupee. Theribulum app available, buy it. They're all the time just doing selling, reselling. They've all become agents of selling apes. They're all the time. Pura time I see in the group only one message available. Code this, apply this code. Price increasing very soon. Are you are students? Study. Okay, I agree. It's a good thing that you are selling. But point is, the primary purpose is study rather than just selling the apps and earning money. This is not going to be your lifelong, profession. You are here to become a doctor. And doctor need to pass the exam. And to pass the exam, don't sell the app, study the apps. So my advice is, study app. Don't just keep buying and selling. That is the concept. Okay, it's like son papdi. Someone get the son papdi, give to other, give to, no one eat the son papdi, they are just passing on. So apps and even our NLC classes, they are becoming just like that. People are just passing it on, है ना, तेरे को चाहिए, हाँ बिल्कुल, इधर से उधर, उधर से इधर, but no one is actually studying. Okay, चल, yeah, this content is sufficient, don't worry. No chance of next this year, they have already postponed. Okay, वही तो कह रहा हूं ना. Even if you sell, what is the purpose? Do you think you're watching? I'm telling you, okay, if in my live class there are very few people watching me live, then I don't think what they will achieve by purchasing anything. If you're not willing to watch me for free, do you think paying money will make you anything better? So that is the main thing. I am teaching. I am the best faculty in physio. As per student opinion, I am the best. And I am taking a free session now. If you're not watching me now, then what are you going to pay for? In fact, any teacher come and take a session. I don't see more than 300-400 students in that class also. Even Dhawan sir take a ENT free session. I don't see more than 3-4. So what is the purpose of selling then? I don't understand. Okay, please study, because that is very paradoxical behavior. Okay, chal, paper would be easy, don't worry. Okay, chal. Now comes the question. Plasma is 25%, IF is 75%. Plasma is inside the vessel. Plasma is inside the vessels and it has no cells. It is blood without cells. So blood without cells. Okay, so blood without cells is the case. Okay, okay, ignore about everything, just study. Chalo, next question. Interstitium is between vessels and cells, also called as aka tissue fluid, and help form lymph. So what is lymph formed from? It is formed from your interstitial fluid. So what is the lymph formed from? Yes, interstitial. Okay, if we make a app for NLC, the same thing will happen. People will not watch NLC app. We do all live classes. They'll be just selling, buying, reselling. So I don't want to, and we have to pay commission to people. I don't believe in these things. I believe those who want to actually study, they will come and take live classes and watch you live, rather than waiting. I'll watch. No one watch a lecture. I'll ask FMGs. You went to your Russia, Ukraine, China, Philippines. You took VD Chaurasia, Thambulingams, Robbins, or whatever. Okay, did you ever open those books there? No, na. Same way, these apps you take, no one watch. 5%, even 5% don't watch. They just keep the app. I know, na. I stay in Gautam Nagar. What the students do? They will keep watching one lecture today, then tomorrow, then they will be just going through some notes, MCQ, random study, random, useless stuff. That's why I don't want to go in that direction. Okay. So tissue fluid help form lymph, and all exchange occur here. All exchange occur here. Okay, all exchange occur here. Fine. So all exchange. That is why called as the internal environment. Or milieu interior. Okay, milieu interior. So where does the exchange occur? Yes. So are you clear now? Okay, so that is the story. And if there is an increased tissue fluid, edema occurs. So increases in edema. So edema is nothing but increased tissue fluid. Okay, वही कह रहा हूँ ना, no one study them. Okay, that's the problem. चल, so let's start next concept. Okay, so I'll just show you. So look at this diagram. Okay, this diagram I'll make it here. So these are the cells. These are the cells. What do they contain? ICF. this is plasma, and this is interstitial fluid, IF. These two combined is ECF. So these two combined are our ECF. So these two combined are ECF. Are you clear? So that's why all the exchange occur here. Like example, cells want glucose. So glucose will go here, and from here it goes to the cell via glutamate. Same way, cells will make waste like urea. So if they make waste like urea, they will dump their urea here. From here it will go to the plasma. So all the exchange occur where? It occur in the interstitial fluid. Okay. Already I will explain the oncotic pressure later, but just remember this. Okay. Yeah. So just go to Telegram and Telegram type integrated learning. You will get the notes. Okay. Clear? So that is the case. Now the composition of internal environment. Good morning, Anshuman. Okay. Yes, Ronaldo. Thank you very much. Yeah. Please keep studying. So next question is all the homeostasis is maintain constant equilibrium. So maintain constant equilibrium. Okay, clear? See, edema occur if there is a increased tissue fluid. So increase in edema. So tissue fluid. So when tissue fluid increases because of filtration of fluid out, it causes edema. Okay, I'll discuss it later. But just remember, edema is nothing but increased tissue fluid. So what is edema? Is increase in tissue fluid is edema. अब सही है? So tissue fluid increase causes edema. Okay. Last thing. So what is homeostasis? It is to maintain constant equilibrium. Maintain constant equilibrium. And who gave it? Walter Bradford Cannon. So Cannon gave what? The concept of homeostasis. So what is homeostasis? Maintaining the equilibrium. Second question. What is the most common method? Most common. See, edema same है, ये English है. अगेन यार अभी इन चीजों में मत लगो आप, प्लीज रिक्वेस्ट करूंगा, ठीक है. एडिमा इज इंग्लिश लैंग्वेज एंड जस्ट एडिमा इज अमेरिकन इंग्लिश. अब समझ में आ गया? सो अमेरिकन्स यूज व्हाट? दे यूज द वर्ड जस्ट ई लाइक ईसोफेगस एंड इंग्लिश यूज ओ ई डी एम. ओके, दोनों सेम ही है, ठीक है, दोनों सेम बच्चा. अंशुमन चलो लेट्स स्टार्ट नाउ. सो द मोस्ट कॉमन सोर्स, मोस्ट कॉमन mechanism is negative feedback. ये पूछा था एग्जाम में, negative feedback. What is negative feedback work? Let me explain. Negative feedback act in what way? There is opposite direction. I'll take medicine also. Okay. Yes. Edema, opposite direction. Yeah, it is in Telegram. Okay, please, this will be a very problematic thing. Please get the Telegram, PDF is there. Just search integrated learning. Okay, PDF there, because I cannot post here. Okay, understand? Okay, so please go and search. You will get this integrated learning. So I'm pinning this message. Okay, yeah, so Telegram you go. Okay, next question. So most common mechanism is negative feedback. Okay. Now, what to say? If there's an increased BP, the baroreceptors, what they will do? They will decrease BP to normal value. This is called as negative feedback. So, what is decreasing the BP back to normal? Baroreceptor. If there is a decrease in the sodium, okay, I'll do MCQs later. Okay, let me teach. Okay, we can solve these doubts, queries later also ना. Clear? अब वो बार बार मैं ब्रेक करके रिप्लाई कर रहा हूँ, फिर प्लीज रिक्वेस्ट करूंगा, ठीक है. ओके, लेट मी टीच फर्स्ट. ओके, आई विल रिप्लाई टू ऑल दिस क्वेरीज लेटर. ठीक है, एक सेशन ले लूंगा मैं ब्रेक में, अभी पढ़ा दूसरी, ठीक है ना. So I put the link, okay, that you can search there. Okay, clear? Fine. Because अभी ऐसा हो रहा है कि मैं कुछ भी बोलता हूँ, मुझे फिर उसका एक्सप्लेनेशन देना पड़ता है. फिर let me teach whatever queries you have, you ask me in the end, I will explain. ठीक है? मतलब it's becoming more like a discussion, not a class. Okay, चल. And if sodium decrease, aldosterone will come. Aldosterone will increase the sodium to normal. This is called as homeostasis. Okay, homeostasis. Okay, clear? So that is the concept of negative feedback. What does negative means? Opposite. So negative means opposite. That is, if you increase something, we decrease it. If something decrease, we need to increase back to the normal value. Are you clear? Now, how do you estimate the volume of chamber? So remember, volume estimation. Any volume, even cardiac output, even lung volume, is given by dye dilution method. By dye dilution method. So which method? Dye dilution method. How does dye dilution method work? It works by that volume is equal to amount of dye given to the chamber divided by the concentration of dye in the chamber. So are you clear? So amount of dye divided by the concentration. So this will give you the value of the volume. Like example, I want to know the plasma volume. So I give a dye in the plasma and check the concentration, that give me the volume. So what is the formula? It is amount of dye by the concentration. Okay, done. Chal. Next question. What else we are also going to do or discuss, right? Okay, the dyes use. I'm telling you, you will understand everything, okay, and you will be able to solve all the PYQs, all the future questions. Just watch the PDF and this watch the lecture, use the PDF. Even you don't have, just watch me, na. Even you don't have that PDF, watch me, take it that topic, okay, and then you can, yes, take it in the break. Okay, first, please increase your resolution. YouTube, you have a function, it give auto resolution. Okay, okay, Benazir, you just go click higher picture quality, it will become, it's a full HD video I am sending from my end. Okay, so please try to change it. Yeah, now TBW, so we use heavy water, which is D2O and T2, deuterium oxide, tritium. It is the best. Then if you want to measure ECF, we use inulin. So ECF, inulin, ECF, inulin, and also we can use sucrose. We can use the sucrose. So we can use the sucrose also. Number 3 is plasma. We use radioalbumin. Or Ivan blue dye. And 4, for ICF we have to use mathematics, total body water minus ECF. I'm just making it simpler. Don't go for any hi-fi calculation. This is what the simplest summary is. So water with water. So how do you measure water? Heavy water. So remember, total body water D2, ECF, inulin, plasma albumin. That's it. Okay. Now we see the transport across cell membrane. So topic is transport. So transport is of two types, active and passive. Active and passive. So what are the two types of transports? Active transport and the passive transport. Are you clear? So there are two types, active and passive. What the difference between the active and passive transport is? Right? Okay, so we can use iodine. Okay, okay, Agdeep, you can ignore it. I'll know it will not come because I've not seen any question asking which isotope. It's radio iodine we are using. Okay, so you can skip it. Okay, active and passive. Active is basically against gradient, concentration gradient, that is low to high, low to high. Okay, so that's why need ATP. Why? Because you're going uphill. What does uphill means? Let's say you are at ground and you want to go to the top of a mountain. So it'll be what? It is uphill. So that's why you are at low level and you're going to a high level. It is called as your active. Passive is a long concentration gradient. Like you are at the top. Now to come down, just need a small push. धम गिर गया. So ये हो गया आपका high to low. ठीक है, ठीक है ऋत्विक, just open the video folder, you will get all the lectures there. Okay, clear? ये आप ब्रेक में मेरे से पूछ लेना, अभी क्लास कर लेते हैं मेरे भाई, ये सारे डाउट्स मैं बाद में आराम से ले लूंगा. ठीक है, अभी तो नहीं देखोगे 19 लेक्चर्स. ठीक है, सो हाई टू लो. So it is high to low, no ATP needed, no energy needed. No energy needed. So I have a question, okay? You tell me which is active, which is passive, okay? So study versus forgetting. Who's active, who's passive? Study or forgetting? All of you, question for you. Study versus forgetting. Who's active, who's passive? Studying or forgetting? Very good, very good. Answer, answer, answer. Where are the answers? क्या बात है? जोएल, अभिरामी, अमृता, रोहित, ऋषिता, दिग्विजय, विजय रेड्डी, योगमाल, क्या बात है? राजू केश, राम, डॉक्टर, दीपिका, क्या बात है? Yes, study is active. Why? You are at low knowledge now. Low knowledge. You know less and you want to go to high expert level. So you are going against. Effort लगता है. Study is effortful. Study. So study is active, but when you do nothing, gone. So that's why forgetting is passive. But sometimes you need efforts to forget. Okay, something which keep coming like X, Y, Z might need effort. Okay, so sometimes you forget, study you forget, but sometimes it could be yes energy required also. Okay, so active forgetting needed for X, Y, Z topic. Okay, easy. Chal. Very good. Now example, example is pumps and vesicular transport. I'll write here vesicular transport. Okay, it could be endocytosis and exocytosis. So endocytosis and yes exocytosis. Okay, sure. Now it is example is osmosis for water, osmosis, yeah, and diffusion is for all others. So diffusion is for everything, ions, then gases, solutes, everything. So are you clear? Very good. Okay, now I am giving you the types. Active is of two types: primary, secondary. So primary and secondary. So what are the two types of active? Primary and secondary. So primary and secondary. Primary is yes pumps. Secondary are sodium transports, sodium symport or co-transport. Means anything linked with sodium, becomes what? Become secondary active. So remember a mnemonic: papa, Papa is pump. And what is secondary? Who come from the papa? The bacha, son. So sa, sa. So if they give sodium import, it is secondary. If they give pump, primary. So pumps are primary, sodium imports are secondary. Don't forget this, okay? Because they are connected to a pump, okay? Yes. So all imports. So example of sodium imports. Example of sodium import. Very favorite topic of examiner. I can in fact tell you 30 July 10:15 AM MCQ number 36. Which of these is not secondary active transport? Option number B will be the right answer. Okay, clear? No, this is too much. Okay, तो ये आपका ज्यादा हो जाएगा, ठीक है. Edit window, I think it will be updated soon. Okay, we will update this. Okay, clear? Bilal will update in every group when it open. Don't worry. Okay, chill. So this is the case. Okay, ये ज्यादा हो गया, ठीक है. So I will remove it. कहीं सही में आ गया तो चलो. Now remember example one is sodium amino acids import, then sodium iodides import, and sodium glucose import. Thank you Akshay. Yes. And also called as or SGLT. It's a very famous name. SGLT is the favorite of examiner. Examiner daily when they wake up in the morning, they make one MCQ from SGLT. Okay, so what the examiner do, ऐसे work oh हरी ऐसे जो भी है ना, या जैसे जो भी है, so he will then go and make a MCQ SGLT. So that's why daily one question come from SGLT. Okay, it is again sodium glucose linked transport. Clear? So yes, you can forget your partner's birthday or anniversary, but should not forget SGLT. Okay, SGLT is more important than birthday date of your girlfriend boyfriend. Clear? Because girlfriend boyfriend, you don't know they will be there or not there in future, but SGLT will always be there in exam also, in your body also. So that's why Guru Gyan, always remember SGLT. Now there are two types of SGLT, SGLT1, SGLT2. Okay, now remember one is in GIT, that is intestine, two is in kidneys. So very simple, how many kidneys we have? Two kidneys, two kidneys. So two kidney. And how many GIT gut we have? Only one, from oral to anal end. So ये oral हो गया, ऊपर से डालो, नीचे से निकालो. So GIT तो एक ही होते हैं ना, gut. So one intestine, it can be small or large, but it's one intestine. So that's why intestine is one. I1. So remember, what is the kidney contain? Two. Kidney contain two. And the, yes, SGLT is one in the case of this. Okay. So fine. Is it clear now? So SGLT. Okay. See, it is mainly present in our kidneys. Okay. There are some other area also where you can find, but you will go with, remember, kidney for two, one for intestine. Okay. Let's move next. Now come passive diffusion. Passive is of two types. Simple diffusion. They are in PCT. I'll discuss that topic again when I discuss kidney, etc. And facilitated. So it is facilitated diffusion. Okay. Welcome Abdul Bhai. Keep learning. Okay. Now just remember one rule. In simple, there is no carrier. Here, carriers or transporters. Carrier or transporter. So if there is a carrier or transporter, it is called as facilitated. If no, it is called as this. Okay. So are you clear? So simple is basically, yes, simple is basically gases like O2, CO2, diffusion. पीडीएफ मैंने ऑलरेडी दे दिया भाई, लास्ट में नहीं शुरू में. टेलीग्राम पे जाओ, इंटीग्रेटेड लर्निंग चैनल पे जाके सब्सक्राइब करो. ओके मेरे भाई, इंटीग्रेटेड, देखो मैंने ऊपर वो भी कर रखा है, पिन कर रखा है मैसेज, टेलीग्राम इंटीग्रेटेड लर्निंग पीडीएफ इज देयर. चलो नेक्स्ट क्वेश्चन, कैरियर्स. एग्जाम्पल इज ग्लूट्स is the example. Clear? Good. So I'm giving a summary. Follow the summary. It should solve you all the questions. I'm giving a summary. Please remember the summary. So let's see the summary. So continue. Okay. Right. See the summary. So let's start now. First summary. So I'm giving a summary. So take the summary. It's very important. ऋत्विक आई टेल ना, अभी कराऊंगा मैं मेरे भाई. फार्मा तो मैंने ऑलरेडी करा भी दिया था रिवीजन. ओके, इफ यू आर देयर आई डिड डिस्कस फार्मा रिवीजन आल्सो. ओके चलो समरी. ओके, मेमोरी के लिए ड्रग्स, देयर इज नो ड्रग फॉर मेमोरी, ओनली वे इज जस्ट स्टडी. ओके, सो रिमेंबर पंप्स आर प्राइमरी एक्टिव. ओजस्वी दैट विल डिस्कस इन रेस्पिरेशन. ओके, फिक्स लॉ, नॉट नाउ. ओके चलो, प्राइमरी एक्टिव मैं सब करा दूंगा. ठीक है, आप वो टेंशन मत लो, टॉपिक क्या है, कब होगा. अभी आप बैठ जाओ, आप ऐसे सोचो कि बस इज देयर, बस इज गोइंग टू एनबी एग्जाम सेंटर टू गेट पासिंग सर्टिफिकेट. दिस द बस, आई एम द ड्राइवर एंड इट्स माय रिस्पॉन्सिबिलिटी टू टेक यू सेफली टू द एग्जाम सेंटर, मेक यू सिट इन द एग्जाम एंड मेक यू पास फ्रॉम द एग्जाम. ओके, बाकी कब पहुंचेगी, कितने में पहुंचेगी, हाउ मेनी पीपल कमिंग, व्हेन विल वी स्टॉप, दिस थिंग्स आर नॉट गोइंग टू हेल्प यू. डोंट आस्क एनीथिंग एल्स. I will cover everything. Okay, just enjoy the ride. Okay, chal. Pumps, then sodium synthase is secondary active. Okay, is secondary active. Okay, ठीक है. Then number 3 is what? It is part 2 will be after the break. Okay, it will be today whole session. Okay, clear? चल, हाँ वही तो कह रहा हूँ ना, वो तो उसका सोल्यूशन नहीं. ओके, इफ आई गो फास्ट देन ऑल्सो, सो दैट्स व्हाई लीव इट. ओके, अभी चिल करो. ठीक है, वॉच योर मूवी, है ना, वॉच योर दिस एंड एंजॉय द शो. देन देयर इज इफ कैरियर्स विदाउट सोडियम, without sodium, it will be facilitated. And last is our none. None will be our, yes, simple diffusion. So please remember them. They are going to be asked in the exam, and you know my expertise. If I'm saying it will come, it will come. Okay, it will come. Okay, again यार मैं कह रहा हूँ, yes, there will be an exam in December for sure. Okay, who will take it? Okay, I say it is done by NB. Even if some other body comes, will you give the exam or not? Yes. Okay, so that's why my request is, don't worry. Even if the exam is taken by NB or next or AIMS, there will be exam. So rather than asking this question ki exam kab hai ne, I will request you only study. Okay, a person who has knowledge, like I have knowledge. You say, sir, when is the class? You say, sir, kal class loge. मैंने कहा हाँ आजा कल ले ले. Sir, person, okay, you come, I'll take the class. I will not be worried about anything else. Why? Because I have the knowledge. Same way, you people just focus on the knowledge. This is the knowledge. Any exam come, NEET, NEXT, USMLE, PLAB, these questions will be there. So rather than asking what exam when, my request is just focus on one thing, ki I will study. I will be notified by everyone ki exam date is announced, exam is taken by this body, that will be the procedure. Give the exam. Clear? So please, my request is Don't worry about all these things. Study, because that is the story here. Okay. Clear? From now on I will not be replying to any or other query, ठीक है, except the study related. If link टूट जाए, my voice is not audible, then you ask. Okay. Other than this, edit window कब खुलेगा, exam form कब निकलेगा, who will take the exam, what color t-shirt I will wear, sir can I wear a cap, sir can I brush that day, sir should I do shit and without shit I should go to the exam center, sir passport expire हो गया मैं क्या करूं, ठीक है, please अभी मत करो प्लीज, ठीक है, मैं I don't mind, but this is not the platform. Okay, that platform will open before the exam, how to prepare, last day preparation, अभी पढ़ाने दो यार, ठीक है, that's what I'm saying ना, let me teach. Okay, let me teach. Okay. चल, अब फिर वही बात यार, नॉर्मल अभी मैं क्या पढ़ा रहा हूँ, फिजियोलॉजी पढ़ा रहा हूँ मेरे भाई, हाथ जोड़ रहा हूँ यार, फिजियो पढ़ा लेने दो, मैं मेडिसिन में करा दूंगा एसिडोसिस अल्कलोसिस, मतलब इसका कोई लॉजिक बनता है? मैं अभी क्या पढ़ा रहा हूँ फिजियोलॉजी, मैं छोड़ के आपको एसिड बेस पढ़ाऊं, मतलब ये तो मतलब ऐसा हो गया कि मैं अपने पैर पे कुल्हाड़ी मारा हूं, जस्ट हिटिंग माई सेल्फ ऑन द एक्स कि जस्ट बिकॉज आई हैव गिवन अ फ्री सेशन आई विल बी गिविंग एनीथिंग यू से, मैं ऑन डिमांड पढ़ाऊं, सब बंद कर दूं ये, है ना, और पढ़ाऊं यार, प्लीज बी लॉजिकल, बी सेंसिबल. ओके प्लीज. अभी फिजियो चल रहा है, फिजियो नहीं पढ़ना चाहते, आपने अपनी मर्जी लगा रखी है क्या? ऊपर लिखा है फिजियो क्लास है, फिजियो पढ़ो ना, आपको कुछ और पढ़ना, अपनी ऐप खोलो, ऐप में जाके पढ़ो. मेरे सेशन में मैं फिजियो पढ़ा रहा हूं, आई विल टीच फिजियो, लेट मी टीच फिजियो. Then they say, why sir teacher don't take sessions for us? Because you are not willing to study. There's a group, you can ask doubt there. Telegram, you can post any question, we do reply. Okay, and there are other people, I'm a physiology teacher, I'm a faculty, ask me about subject. Okay, don't ask me other irrelevant things. वो मैं बाद में सेशन लेता हूं, I can reply that after class also. I don't know what kind of kiddish behavior is this. Cell junctions between cells. Okay, first there are tight junctions, okay, they are also called as zonula occludens. I have to finish physio in whole day. After I finish, I can take your doubt. Okay, tell me, I'll explain. You ask me, sir, tell me, even your shirt size, I'll tell you. Okay, sir, what do you eat? I'll tell you. Sir, what is your bank account number? I'll tell you. But at least let me finish ना. अभी बीच में आप कुछ भी पूछे जा रहे हो, कुछ भी, anything which comes to your mind is not a free session. Okay, it's a free session for physio, not a free session for anything. Occludens. Okay, what is the purpose? They make barriers. Example, blood brain barrier. Then blood testis barrier was asked in your last exam. Blood testis barrier. So what barrier? Blood testis barrier. Fine. So blood testis barrier. Okay. Then also present in what? Yes, placental barrier. So all the barriers, what do we have? We have is the, yes, tight junctions. Okay, and what the protein? Okay, they use proteins. Which one? Occludin and claudin protein. So occludin and claudin protein is this case. Okay, so occludin and claudin protein is this case. I have lots of patients here. I don't get angry. Okay, I have been in such worse situation, I can't even tell you. Still, I maintain my composure and I can teach. But here I have a pressure, I have to finish the subject. First day, first topic I'm starting. And even then I'm just being, disturbed uselessly. Okay, there's no point. Okay, and I'm someone who doesn't ignore people. I cannot ignore anyone asking doubt. So ये तो हो गया कि I am being extra helpful, trying to answer all the query. That means I can be having no what do you say, sequence, no order, no preference, जो मर्जी करा लो. तो बाकी लोग जो है वो मतलब ऐसा हो गया बस चल रही है सर, एक मिनट एक काम करना सर, कैन यू स्टॉप बस एंड टेक मी नॉट टू एग्जाम सेंटर, क्या एक बार वहां पे घुमा के लेना, यूटर्न लेना बस में, मेरा घर छूट गया है. It's a bus, okay? It's not your private taxi. It will go as per the bus designation, not as per whims and fancies of people one by one, okay? Chal, let's start, okay? So that is the case, okay? And blood testis barrier is by Sertoli cell. So Sertoli cells are there, okay? So Sertoli cell, okay? I would have finished it in just 30-40 minutes rather than just wasting my so much time. So summary, tight junctions are occludin. Tight junctions are occludin and they are barrier. 3 words, tight, barrier, occludin. Tight, barrier, occludin. Second is desmosomes. They are cellular cement or glue. So they keep cells together. Keep cells together, also called as macula adherens. Macula adherens. So they are macula adherens, okay, and they are called as, clear? So they are called as what people? So yes, so they are made by desmosomes are made by cadherin, cadherins, also desmoglein. So cadherins and desmoglein, desmoglein, okay. Third is our what? Third is we have is the gap junctions. Made by connection protein, and what they do, they connect cells electrically, connect smooth and cardiac muscle fibers and make them contract. Yes, make them contract as single unit. Are you clear? So gap junctions are made by connection protein. They connect our what? Smooth and cardiac muscle fiber and make them contract as what? As a single unit, okay? So yeah, they can be present in the electrical synapses also, but they are mainly present in the smooth and cardiac muscle. So let me give a summary. Remember the summary. This is the main thing. So first, I'll start with tight. So what are tights? They are barriers. And what the protein they have? Occludin. Then come our desmosome. They are the glue. They connect adhesion. They are by cadherin. They are by cadherin. Okay, they are the cadherin. Then last is our gap junctions. Gap are for electrical currents and they are, yes, made by connection protein. Please remember this summary. It will give one question for sure. Okay. Thank you. Thank you. So this is your concepts. Please remember. So what is joining the cell? Yes, cells are joined, addition by cadherin. What is allowing currents to pass? Connection. What is the barriers made by occludin? 100% MCQ. I'm telling you. So 100% MCQ would be there in the exam whatsoever. Okay. Now I am starting with yes, CVS. So before lunch we'll do CVS, after lunch we'll do the remaining system. So let's see the CVS. So in CVS, first remember there are two type of tissue. One are the nodal tissue like assay node, example assay node, and the cardiac muscle. Cardiac muscle. Now cardiac muscle, they contract. Cardiac muscle will contract. Cardiac muscle contract and okay, this is a summary. So clear? So this is a summary. Okay, copied. Okay. So there are two type of tissues. One are nodal tissue like assay node and the cardiac muscle which contract and pump the blood. So they contract and pump blood. Now assay node is autorhythmic. It is autorhythmic and it is a pacemaker as it make what? As it make action potentials APs at maximum frequency या maximum rate. How much? 70 to 100 per minute. So it is 70 to 100 per minute. So that is the pacemaker. Okay, I'm making the diagram of the AP. Please have a look and just remember the step. They will not ask you much. So making the AP of cardiac muscle first. So understand what is the AP in cardiac muscle. Action potential. So it has the parts like this. So this can be asked in the exam. So this is your depolarization. So this is phase 0. And it is by sodium channels. So sodium channel. So sodium channels are the ones. Okay, this is our phase 1. Early repolarization by potassium channels. This is phase 2 plateau. This one. By calcium L channels. Okay, what is the benefit? It increases refractory period and prevent arrhythmia. So what is the benefit? It increases the refractory period. So what causes long refractory period is the plateau phase. Because of plateau, the AP become bigger, and if AP become bigger, the membrane is not going to fire again. It will take long time to finish one AP. So how can you start the next AP when one AP is over? But because of this, there is a long refractory period. Refractory means membrane is not excitable. Okay. Then come phase 3. This is phase 3, late repolarization. It is caused by our rectifier potassium channels. And then phase 4 is RMP. So phase 4 is our RMP. Okay. Fine. Okay. Now let me tell you the AP in nodal tissue. AP in nodal tissue. So what is the AP? Yeah, phase 1 and 3 are potassium. 1 is just potassium, 3 is rectifier potassium channel. So AP in nodal tissue. Okay, so make this AP. So here there's a period, this is phase 0 depolarization. This is phase 3 repolarization. What is missing? There's no phase 1 and 2. No phase 1 and 2. So they are missing. So what is missing? Phase 1 and 2 are missing. And what is this period? This period is called as phase 4. Phase 4, also called as pacemaker or prepotential. Pacemaker or prepotential. Okay, why? It generate next AP. So that means the phase 4 trigger the next AP. This is the second AP. Then again phase 4 will trigger the third AP. So that means we are getting new APs again and again and again. So are we getting new APs? Yes. So we are making the new AP again and again. So understand, phase 0 is depolarization, then you repolarize, 1 and 2 is absent. Then in phase 4, the membrane again climbs up and it reaches the level of AP, and this causes next AP. So who's causing? See, it is a nodal tissue. It has to make impulses, not to wait for current to come. So if it has refractory period, it will not make its own impulses. So it's a muscle for contraction, not for making the current. Who make the current? Nodal tissue like the SA node. So that's why it has no phase 1 and 2 refractory period, but phase 4, which is pacemaker potential. So what is pacemaker? Generate next AP. Generate next AP. And what channel it use? It use funny or leaky sodium currents, sodium channels, and calcium T channels. Yes, very good. Funny sodium channel and calcium T. Your name itself is that. Very good. See, nodal tissue they look like nodes, concise ball-like structure. They are nodal tissue. They are pacemaker tissue. They make impulses, current. So that's why they are making automatic current. So they are making automatic current. So understand, what is making automatic currents? It is your nodal tissue which make the automatic impulses, that is called as nodes. Okay. How they make the currents? They have special channels called as funny sodium channel and the calcium T. They create the currents which create new AP. So these currents create new action potential. So what create the new action potential? It is by our funny leaky sodium channel and calcium T channels. Are you clear? And the calcium T. Understood? All of you? See, ivabradine act on funny sodium channel, block it. That is in pharma. I discussed already. You can watch my pharma revision video. There I discuss about the funny channel blockade by ivabradine. Okay, ivabradine. Done? Chal. Let's move. Let's see the movement of current. SA node is the pacemaker. It sends impulses to the AV node. AV node has slowest conduction. Cause AV delay. So it is the slowest. It's all in the notes. No need to write. AV delay 0.1 second. 0.1 second. Then impulse goes to bundle of his. From there it goes to bundle branches. then goes to Purkinje. This is the conduction pathway. Purkinje are the fastest conduction speed. They are the fastest speed. So remember, it's like pari, पापा की परी उड़ गई. So परी उड़ के आती है, so परी. So Purkinje is the fastest speed. Why? Due to maximum gap junctions. So because of maximum gap junction, highest speed is Purkinje fiber. So who's the highest speed? Purkinje fibers have the highest speed available. Purkinje fiber. Are you clear? And Purkinje give currents to the ventricles. They supply ventricles and make ventricles contract and make the ventricles contract. So Purkinje cause the ventricular contraction. Are you clear? Fine. Now we'll discuss cardiac cycle. What is cardiac cycle? It is events occurring. Okay. Yeah. Events occurring in one heartbeat. 0.8 second. So whatever events occur in one beat, it is called as the cardiac cycle. Are you clear? So cardiac 0.8 second. Okay. So what is the direction of flow? Impulse start from SA node. Okay. Then it goes to what? AV node. AV node is very slow. It causes the delay. Then after delay, impulse reach the bundle of His. His will give to branches. Branches to Purkinje. Purkinje have what? They are the fastest speed. Purkinje like पापा की परी उड़ के आती है ना पर Purkinje. So Purkinje are very fast and they give current to ventricles. Ventricles then contract and pump the blood. So that means our cardiac cycle is all about events which occur in one heartbeat. Okay. See, paper will be always easy if you have studied. If you have not studied anything, paper will be difficult. A topper who has studied all year, he knows he will get 90% plus. Okay. And that's why I know paper will be easy because we all have worked hard and the question will be from notes itself. Are you clear? Fine. So two part, systole and diastole. Systole and diastole. Okay. Systole is for contraction and pumping. And ejection, and diastole would be yes, relaxation and filling. Relaxation and filling. Clear? So that is the main funda. So clear? So systole is for contraction and ejection and diastole is for relaxation and filling. Fine. Okay. Kushi, watch it now. Okay. It will stay. Okay. And it will be there till the end of the exam. Okay. Please watch it now. That's my request. Now, what is the duration in ventricles? It is 0.3 second. Diastole 0.5 second. So 3 second and 0.5 second is the duration. Okay. So let's start the findings. So remember, there is heart sounds, and what is the cause of heart sound? So S1 is due to the MV and TV closure at the start of systole. Closure. Okay, due to ventricular contraction. Okay, so ventricular contraction. Fine. Whereas S2 is the AV and PV, aortic and pulmonary valve closure, due to, yes, due to end of ejection, in systole. Are you clear? End of ejection in systole. Very good. S3 is early filling. And S4 is late ventricular filling. So early filling and the late ventricular filling. So it will be late ventricular filling. Are you clear? So it would be late ventricular filling. Okay. So we have the early filling and we have the late. So let me now make the cardiac cycle. See and watch with me. S1, S2 is systole, S2, S1 is diastole. This is systole, this is diastole. Okay. So systole and diastole. Now first question, what happens at S1? The MVTV close. Okay. Thank you, bhai. Thank you very much. Okay. So let's start now. Okay. So S1 is MV TV close. Okay. MV TV will close and the valves are closed. If all the valves are closed, the chambers are in what state? Closed state. Like this is RA, LA, RV, LV. So what is the status? All the valves are closed. So that's why it's called as isovolumetric contraction. Isovolumetric contraction. So isovolumetric contraction. Now what happens because of that? The pressure will open the valve. So AV, PV open. ठीक है, वही कर रहा हूं भाई. I am trying to solve as many questions as possible. So AV, PV will open and now ejection will start. What occurs? Ejection. Now once the ejection is over, the AV, PV will close. As AV, PV close, ejection is over, systole is over. And now we will start the relaxation. So what start now? Isovolumetric relaxation. And as we relax, the pressure will fall. This falling of the pressure will open which valve? It will open the MVTV. Sorry, AVPV open here. Now what happens? The MVTV will open. Yeah. So MVTV, sorry, MV and TV will open. Now as the MVTV will open, the filling will start. So what start? Filling. And filling is of two types. Early filling, early passive, and late active. Late active by atrial contraction. So it is caused by atrial systole. So what are the two kind of filling? Early filling and the late filling. Early filling sound is S3, late filling S4. And between the two fillings, there is diastasis period. Diastasis. So this is, yes, early is by MV opening. Early is by MV opening. So early passive filling is caused by MV opening and late is caused by atrial contraction. Late is by atrial contraction. 100% question will come from this topic. I can assure you, this is my personal experience. This is not going to be missing from the exam. So what is the topic? This is the topic which is asked in the exam. Are you clear? Done? So please see this diagram. Remember, so once again, S1, S2 systole, S2, S1 diastole. So whose systole? S1, S2. Diastole is S2, S1. What are the ठीक है, डोंट वरी यार, आई विल बी ओके सून. चलो ठीक है, डॉक्सीसाइक्लिन भाई प्लीज वेट, ठीक है, इसको मैं एक बार करा दूं, देन आई विल ट्राई टू डू. ओके, बस अभी याद कर लो, दिस इज द स्टोरी एंड रिमेंबर कॉन्ट्रैक्शन इज आफ्टर QRS and isovolumetric relaxation is after T wave. बस इतना याद कर लो, से सारे क्वेश्चन सॉल्व हो जाएंगे. सो आइसोवोल्यूमेट्रिक कॉन्ट्रैक्शंस आफ्टर QRS इन द ECG and what is the relaxation is after the T wave, after the T wave. So what come after T wave in ECG? Diastole. What come after QRS? This. Okay, and late filling you get the P wave. तो पूरा ECG हो गया आपका ही, सही है. So P wave. So P wave will come before the atrial systole, T wave will come before the diastole relaxation and the QRS के बाद क्या आएगा आपका isovolumetric contraction. Okay, doxycycline, I've covered this part also. Now we'll see. So summary हो गई ना आपकी, revision भी हो गया. So summaries: S1, S2 systole. For the first period is our isovolumetric contraction, that is after QRS in the ECG. High pressure open the aortic and pulmonary valve, ejection occur. After ejection, the aortic and pulmonary valve close. That cause S2 sound. Then ventricles start to relax. What is the ECG change? T wave. And ventricles are relaxing, and then the pressure fall, MVTV open. Once they open, the blood from the atria fall to ventricle, filling occur, called as early passive filling. And then there is no filling, diastasis means no filling. Then there is late filling by atrial contraction. So who caused the late filling? Atrial contraction. I have explained from the beginning. ECG I will cover in medicine. So watch it in medicine revision class. Okay. So have you understood? So simple summary is very simple. S1, S2 systole, or the 2 period, iso and ejection. S2, S1 diastole, 2 period, isofill. Easy. Now crystal clear. So S1, S2 systole, iso ejection. S2, S1 diastole, isofilling. Okay, done, Lakshmi? Understood? So this is the story. Now we'll see the ECG, JVP. So JVP basically from internal jugular vein. Internal jugular vein, okay, and show right atria changes. Normal value 0 to 5 mmHg or 0 to 8 centimeter H2, also called as AKA. What is it also called as? It is also called as what? Okay, right? It is also called as what? Yes, CVP. CVP, that is central venous pressure. Done. Let's see the waves of the JVP. So it's like this: A wave, C, X, V, Y. So A, C, X, V, Y. These are the wave. A is atrial contraction. A is atrial contraction. C is ventricular contraction. Okay, so remember, A is atria, C is ventricle. A is atria, C is ventricle, and X is atria relax. So remember, when problems in your life become your X problem, X, we should relax. So when should one relax? When problems become their X problem. Okay, so that's why remember, one day your current problem will become your X problem. That's the rule of nature. Or you will become their X problem. So ultimately, one will always be becoming X. Technically, when a pair is broken, it creates. So when a pair is broken, it creates 2x. Okay, so that's why it always create 2x. Then they create two different pairs that create two pairs. And when these two pairs separate, it creates 4x. So one day the world will only be full of x, x, x. Guru Gyan, okay? So one day will only be left with x, x, x in the whole world. Okay, so that is the story of the life. Okay, so we are not giving birth to babies, we are giving birth to x and x. So technically you are someone x, they are someone x, they are also someone x, 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 x. Everyone is x. Chal. Now comes the V. V is atrial filling. Atrial filling. So when we say bad about X, technically you are saying bad about you also. It's like pointing finger. When you point finger at someone, three fingers are pointing towards you. So same way, okay, when you are saying bad about your X, that means you are saying bad about them. They must be saying about you. And maybe they are telling to more people. Like when I say bad about my X on the class or somewhere, technically I'm saying to thousands of people. So that's why it is not a good thing. So I never say bad about any X, Y, Z. I always respect them. Why? Because they gave us lots of, yes, experience and other things. Okay, chalo. And then comes, yeah, by Vina Kava, experience, yes. So V is Vina. So V is the Vina Kava. Okay. Yes, yes, yes. They spared our life. They might be spoiling someone else's life, but at least they spared your life, no? Why is your, yes, it is due to atria empty. And ventricle fill. So how to remember? Why? Okay. So clear? So it is Y and Y. Why? Understood all of you? Chalo. Now we'll discuss about the volumes. Volumes. Yeah. See, V is when atria is filled by vena cava blood. Okay. Clear? Yes. Y is empty. Why? Okay. Atria to ventricles is Y. Yes, you are right. Okay. We'll have three parts. Okay. Three parts of the, yes, class. Chal. We have covered two systems. After lunch, we'll cover three or maybe four systems. Okay. Chal. Now volumes. First is ADV and diastolic volume. Normally 120 to 130 ml. Okay, clear? Yes, you can make notes here or you can download the PDF I have already given. Okay. Okay. Chalo. You can do anything, Bilal. It's up to you. But I hope they are also not making plans against you. If you are making plan against your XYZ enemy, they might also be making plans against you. That is why I don't do anything bad to anyone, because I don't know what will happen to me itself. Chalo. Let's start. Number 2, SV. It is the, sorry, the definition. It is blood filled Yes, you can make the notes, bhai. It is blood filled in diastole. So how much blood will fill in the diastole is your EDV. It is your EDV, okay? And it depends on VR, venous return, and increase EDV cause increase preload. So high EDV causes more preload. Number 2, SV. What is SV? Stroke volume. Stroke volume. Normal 80 ml. Okay. Fine. Okay, if someone is asking, he's saying कि if the ex is making her kids call you as mama, that means technically she'll making you abuse, very bad abuse, you know. So that is not right. Okay, so you can tell the kids the truth. Okay, कि yes, they should call you papa, not mama, है ना. Okay, मम्मा तो वो है, आप तो पापा हो, तो क्या बोलोगे? मामा इज शी, यू आर द पापा, है ना. सो दैट इज द केस. ओके, सही है. चल आगे चलते हैं. नेक्स्ट, स्ट्रोक वॉल्यूम. स्ट्रोक वॉल्यूम, ओके, इट इज ब्लड pumped by ventricle per beat. Per beat. सही. Then number 3 is ESV. It is end systolic volume. It is blood left after systole. After systole. Normal 40 ml. And what is the formula of ESV? EDV minus SV. So EDV minus SV give you the ESV. It gives you the ESV. So what is ESV? It is EDV minus stroke volume. Last is number 4, our EF. What is EF? Ejection fraction. So EF is our ejection fraction. So what is EF? Is ejection fraction. What is the formula of EF? Is stroke volume by EDV 100. It is ml. You can take 40-50 ml. Okay. So what is that? It is percentage of blood pump by each ventricle. So percentage blood pumped by each ventricle. So yes, you remember the formula. Normal is 65%. So let me just revise you in a very simple way. So I'm giving a summary. What is volume filled? It is EDV 120 ml. What is volume pumped? It is stroke volume 80 ml. Easy. What is volume left? It is ESV 40 ml. And what is percentage pumped? It is ejection fraction, that is 65% or 2/3. Is it now easy? Because they will be asked in the exam. I'm not lying. You will go to exam and you will see questions coming from the notes, from the RR, from the revision, and you will be like, okay, I should have done this properly earlier. So that will be there in the exam. So volume filled is EDV. Volume pump is stroke volume, volume left is ESV, and percentage pump is ejection fraction. Percentage is ejection fraction. Okay. So clear? Yeah. JVP, AP will be giving you maximum question because NEET they are asking lots of question from action potential. I discussed that. Then they are asking from JVP volume cardiac cycle. I've discussed that also. Okay. Now we'll see the blood vessels. So let me just teach you the blood vessels. So let's discuss that. Okay. So we have discussed all these things. Okay. Relaxation, pressures. Okay. Also the case. Now we'll discuss the cardiac output. Let's discuss that. JP is also done. EDB done. Summary. Factors affecting venous rhythm. So let's discuss the factors affecting venous rhythm. Gravity. Like when you are standing, maximum venous rhythm. When you lie down, maximum and minimum is in standing. So minimum in standing, maximum is in what? Supine. Then calf muscle. So when you walk, the calf muscle like soleus, they contract the leg veins and increase venous rhythm. So how they increase venous rhythm? By compressing leg veins. Okay. Then there are venous valve. What they do? They don't let the blood go down. So they prevent the backflow in the veins. Then inspiration. There is a negative pressure in the thorax called as intrathoracic pressure, which I'll discuss in respiration. It pulls the blood towards the heart and increase the venous rhythm. So inspiration causes more venous rhythm. Then sympathetic alpha 1 receptor cause venoconstriction, which increase the venous rhythm again. By compressing the vein, the blood is shifted to the heart. And there is a loss of sympathetic in case of neurogenic shock, which causes venodilation. So veins will accumulate the blood. This is called as warm shock because the blood is in the veins, and that's why we give norepinephrine as the drug of choice. What we give? Norepinephrine in this case. Okay. Last point, deep fascia. Deep fascia, remember athletes when they are running, they wear some tight stockings. So these stockings are very thick and tight in the leg. They keep the muscles and veins compressed. So what they keep? The muscles and the veins compressed, thereby increasing the venous rhythm. So what are the 6 factors? Let me ask you. So what is increase VR by? Just write with me. What position? Supine. Then what? Exercise. Yeah, just say calf muscles. Then inspiration, sympathetic, then fascia and valves. Easy, na? So this is summary. So supine, calf muscle, inspiration, sympathetic, fascia and the valves. They all maintain venous rhythm. So they all will maintain our venous rhythm. Okay. Let's come back. Now we see the types of the vessels. Before that, cardiac output. So what is the blood pumped by ventricle in 1 minute or per minute is called as cardiac output. It can be given by echocardiography or dye dilution or thermodilution method. So dye dilution or thermo. Formula is stroke volume into heart rate, around 5 liters. So the cardiac output 5 liter is the normal cardiac output. Okay. Now during exercise, cardiac output can increase, and this is called as cardiac reserve. So what is cardiac reserve? It is the extra cardiac output. What is the value? 20 to 25 liter per minute. Now how do you increase? Let me explain. When we exercise, there is a law called as Frank-Starling law, which say more you fill the heart, more you will pump. Let me write it here. So remember, what does Frank-Starling law say? So it says that EDV is proportional to stroke volume. More the EDV, more the stroke volume. In simple language, more filling, more pumping. More pumping. So this is called as Frank-Starling law. If you make a graph, it gives something like this. This is stroke volume. This is EDV. This is Frank Starling curve. So let's say EDV is 120 ml. This is 80 ml. This is 130 ml. And this is 90 ml. So as there is an increase in EDV, what is increasing? The stroke volume is also increasing. Okay. And this is called as what law? Frank Starling law. Frank Starling law. Okay. So we'll take the lunch now. 40 minutes. And I'll continue after 40 minutes. New link will be there. I'll share it again in the channel. So new link. Okay. So let's meet after 40 minutes. So lunch till that time. Okay. So let's meet with new link. Okay. Take care. Bye bye. So new link will have the so I'm ending the screen. Okay. Just search integrated learning. Okay. Integrate Telegram integrated learning. Okay. Check. Link will be pasted in YouTube also and Telegram. Okay. So Telegram, please search integrated learning channel. You will find it. Join. Okay. Take care. Bye bye. Asiba, Tanuj, Vam Tuji.